Ever wondered how breast cancer manifests? While it's true that in some instances breast cancer may not show symptoms, a cancerous mass can still be detected in a woman's routine mammogram. Breast cancer screening, as recommended by a doctor, can help detect this condition in its earliest, most treatable stage. Though more common in women, men are also at risk of developing breast cancer. First, let's consider changes in skin texture. Breast cancer can cause changes and inflammation in skin cells that can lead to texture changes. Examples of these texture changes include scaly skin around the nipple and areola, akin to sunburned or extremely dry skin, and thickening of the skin anywhere on the breast. These changes may also cause itching, which people often associate with breast cancer, though it is not common. Skin changes, like nipple peeling, can be symptomatic of a rare type of breast cancer called Paget's disease. Thickened skin and texture changes can be consistent with inflammatory breast cancer. However, texture changes can also happen due to benign skin conditions, including dermatitis and eczema. Second is nipple discharge. An individual might notice a discharge from the nipple, which can be thin or thick and vary in color from clear to milky to yellow, green, or bloody. Discharge typically comes from one nipple, but if both breasts are cancerous, it can come from both nipples. While it's normal for those breastfeeding to have milky discharge from the nipples, it's advisable to consult a doctor about any other nipple discharge. Though most nipple discharges are not cancerous, for some people it could mean breast cancer. The most concerning nipple discharge tends to be bloody, affecting one nipple, and spontaneous. Other possible reasons for nipple discharge might include birth control, certain medications, and some infections. Lastly, dimples. Dimpling or puckering of the skin can sometimes be a sign of inflammatory breast cancer, an aggressive type of breast cancer. Cancer cells can cause a buildup of lymph fluid in the breast that leads to swelling, as well as dimpling or pitted skin. Any changes in the skin's appearance, like peau d'orange, a term doctors use to describe skin that looks like the surface of an orange, should be brought to a doctor's attention. This change can also be accompanied by the appearance of erythema or edema of the breast, which is redness and swelling. In summary, changes in skin texture, nipple discharge, and dimpling are potential signs of breast cancer. However, they can also be due to benign conditions. Therefore, it's essential to consult with a doctor if these symptoms occur. Remember, early detection is the best defense against breast cancer.
Have you ever paused to consider the subtle signs your body could be signaling about breast cancer? The awareness and understanding of these symptoms play a critical role in early detection and treatment. Let's delve into these symptoms and their explanations. Firstly, lymph node changes. Lymph nodes are small, rounded collections of immune system tissue that filter fluid and capture potentially harmful cells. These include bacteria, viruses, and cancer cells. If a cancer cell leaves the breast, it usually travels first to the region of the lymph nodes in the armpits, on the same side as the affected breast. This can lead to swelling in this area. Besides swollen lymph nodes in the armpit, one might notice them around the collarbone. They usually feel like small, firm, swollen lumps and may be tender to the touch. However, lymph tissue can also change due to breast infections or other completely unrelated diseases. Therefore, it's crucial to consult a doctor about these changes to identify a potential cause. Secondly, breast or nipple pain. Breast cancer can cause changes in skin cells that lead to sensations of pain, tenderness, and discomfort in the breast. Although breast cancer is often painless, it's essential not to ignore any signs or symptoms that could be due to breast cancer. Some people may describe the pain as a burning sensation and tenderness. Thirdly, retraction or inversion of the nipple. Breast cancer can cause cellular changes behind the nipple. These changes can result in the nipple inverting and turning into the breast, or it may appear different in terms of size. The appearance of nipples can often change during ovulation or other parts of the menstrual cycle, but it's important to consult a doctor about any new changes in the nipples. Fourthly, swelling. Breast cancer can cause the entire breast or a part of the breast to swell. There might not be a distinct lump after this swelling, but the breast might be different in size than the other breast. While it's possible for people to have slightly different breasts in size at all times, this swelling would cause a change in relation to the usual breast size. Lastly, changes in breast size. Most people have breasts that are not the same size as each other, which is normal. However, if one breast increases in size without explanation, it could be a sign of breast cancer. If someone notices that one or both breasts have increased in size, they should consider contacting a doctor. In summary, the key points to remember are the symptoms of breast cancer, which include lymph node changes, breast or nipple pain, nipple retraction or inversion, swelling, and changes in breast size. It's crucial to consult a doctor if you observe any of these symptoms to ensure early detection and treatment of this disease. Remember, early detection saves lives.
Are you concerned about changes in your breasts? It's quite natural to feel a little uneasy, but remember, not all changes spell doom. Factors like aging, hormonal shifts, and others can lead to breast changes throughout a person's life. However, it is always wise to be proactive about your health. Let's dive into 9 changes that should prompt a visit to your doctor. First up is a new lump or mass. It could be painless, hard, and have irregular edges, or it could be tender, soft, and rounded. Second, swelling of all or part of a breast, even if no distinct lump is felt, should not be ignored. Third, if you notice skin irritation or dimpling, it's time to book an appointment. Fourth, any breast or nipple pain that doesn't seem related to your menstrual cycle should be checked out. Fifth, a red, scaly, or thickened nipple or other parts of the breast skin might warrant a doctor's visit. The 6th change to watch out for is nipple retraction, where the nipple turns inward. 7th, if you see any nipple discharge other than breast milk, especially if it's bloody, it's time to consult with a doctor. 8th, any change in the size or the shape of the breast needs attention. And 9th, if you notice any lumps in the underarm area, don't hesitate to bring it up with your doctor. These changes, especially if they seem unrelated to your menstrual cycle, injury, or previous disease such as a breast infection, merit a visit to your doctor. They can evaluate your symptoms, examine the affected breast or breasts, and recommend further tests if necessary. To summarize, any changes in your breasts should not be taken lightly. Be it a new lump, swelling, skin irritation, or any other change we discussed, it's always better to consult with a doctor. Remember, your health should always come first. Being proactive can help rule out potential causes and provide peace of mind so you can continue living your life with confidence.